My name is Dariush Nikkhah, and I'm a consultant plastic and reconstructive surgeon based at the Royal Free. I specialize in microvascular surgery and also breast reconstruction. Usually our patients who've had a single side reconstruction are an inpatient for 3 days, but it can be longer if the operation is prolonged. Patients have one-to-one nursing for the first 48 hours, but patients get out of bed on day 1, usually have their catheter out on day 1 or 2, and home on day 3 after physiotherapy. Some patients have to go home with a drain, but in some cases, if it's suitable, patients don't even have drains in the abdominal donor site. It's changed a lot. We've got something called an enhanced recovery protocol. So it means that when I trained 10 years ago, patients used to stay for a very long time on the ward, 7 to 10 days. We've reduced that to 3 to 5 days. And we've been doing things to try to make the surgery more efficient so patients that can go home sooner. Bilateral reconstructions are often longer operations, and sometimes patients have to stay in a little bit longer. Again, we've done things in the Royal Free to minimize operative time with this co-surgeon model, which is unique to us here at the Royal Free, and it has enhanced patient safety and improved outcomes in our department. So I think the latest innovation is something that we pioneered here at the Royal Free. We have reduced the internal incisions when you harvest the DIEP tissue transplant. This can be done by hand or laparoscopically or robotically assisted. So far at the Royal Free, we have done it laparoscopically, and this has enabled patients to have less pain. So potentially patients can go home much sooner. It's not suitable for every single patient, but those patients who have got the correct anatomy or have got the suitable abdominal donor site, they can have this what we call minimal access DIEP. And I think that looking at the future will probably be one of the major innovations in DIEP flap surgery. I think it's very important to be versed in the older techniques. So in some patients, it's not possible to do a DIEP flap. And that may be that they've had multiple previous abdominal surgeries, the tissues are very scarred, the vessels are stuck in the muscle. So we still do procedures called muscle sparing trams. And if patients aren't suitable to have a DIEP flap, there are other forms of reconstruction that we routinely do at the Royal Free. We're also experts in thigh-based reconstruction of the breast, so using the thigh as a microsurgical donor site. This is an operation called the TUG or PAP flap. This is one of our second choice sites for breast reconstruction. Also, there are operations where you can take the tissue from the back, the latissimus dorsi, to reconstruct the breast. I tend not to do this as the primary choice because it is a big muscle. There are problems with the donor site. I don't often use it with an implant, but it's a plan B, C, and a good plastic surgeon always has a plan B and a plan C. So plastic surgery is a specialty that I've always loved because it's one of the few specialities where you can operate on the entire body. You can operate on all age groups. It's a very collaborative specialty. We've also been likened to the surgeon's surgeon. So we work with a number of different surgical teams. So in my practice, I work with cardiac surgeons, neurosurgeons, transplant surgeons, breast, orthopedic. So we collaborate with many specialities, and we're quite famous for innovation, plastic surgeons. And actually the original plastic surgeon based in Hampstead was Harold Gillies, who was the father of plastic surgery. And we've got a big heritage of reconstructive surgery here at the Royal Free, particularly in reconstructive surgery and microsurgery, which is my area of passion and expertise.